Okay, I'd like to welcome everybody to the Caregiver Stress and Depression webinar. My name is Dr. Mike Lau. A few things before we start. I'd like to thank you all for participating tonight. Throughout the presentation, I'm going to encourage you to interact by typing questions and comments throughout the presentation. You can do that by using your questions pane that you see on the right-hand side of your screen. If you cannot visibly see your questions pane, go ahead and just click on the red arrow to expand your menu bar. What I'll do is I'll answer any questions that you have during the presentation or throughout the presentation, but what I'll do is I'll answer those questions after the presentation is over. So if you have a question during the presentation, just go ahead and type it in, and then I'll answer everything after the presentation is completed. If you do have a question that I'm not able to answer, I will email you within 24 hours after the presentation. Okay, so I will definitely get back to everybody and answer all their questions within 24 hours after this presentation. I'd also like to remind you that we are recording today's webinar, and we will make this available. We'll make this webinar available to everybody approximately 48 hours after the presentation. So if you do miss something, don't worry. You'll have the opportunity to go back and view any part of the presentation within 48 hours, 2 days after this presentation is completed. So again, I'd like to welcome you to the Caregiver Stress and Depression webinar. Helping yourself through some tough times. As an overview, what I'm going to do is just kind of break this out into 4 kind of general areas. I want to talk a little bit about an initial diagnosis, a communication, helping your loved one, and then taking care of yourself. That's kind of how we'll break this out tonight. The initial diagnosis. Approximately 50 million Americans have a diagnosable mental illness or suffer from a diagnosable mental disorder. That equates to about 22% of the population. Unfortunately, this is going to affect many, many more people. When you start adding this up and looking at the family members, immediate family or extended family, it's much more than 50 million Americans, much more than 22% of the population. Acceptance of a mental illness can be very difficult. And actually, this is the first step in dealing with mental illness or the initial diagnosis. Acceptance is always that first step. In terms of acceptance of a mental illness, you can expect a range of emotions. This is not going to be unusual, and they can come on pretty unexpectedly. Understand that all these feelings, all these emotions, these are going to be normal. Whether these emotions are anger, fear, sadness, these are all normal, and you need to honor these emotions. You also have to share these emotions and share these feelings with your loved ones and with your family members. Another important piece of this initial diagnosis step is to deal with the diagnosis of your loved one day at a time. Don't leave your loved ones out of family matters, family decisions. It's real important. You want them to still be included in what's going on with the family. Try not to isolate your loved ones. Try not to again leave them out of real crucial decision-making opportunities. But also don't overlook your own needs, and also understand that your loved ones will experience their own feelings of fear, their own feelings of isolation. So we have to understand not only our own feelings, but their feelings as well. Understand that you're going to be an invaluable emotional support for your loved one who's suffering from a mental illness. Try to listen attentively to what they're saying. You want to encourage your loved one to be physically, emotionally active as much as possible. It may sound very simple to, encourage your loved one to be physically active, to get exercise, but that can help an incredibly amount. It can be a very effective way to deal with the mental illness. Encourage your loved one to share his or her feelings with you. Try not to let them be bottled up day in and day out. Again, let them know that you're going to be an invaluable emotional support for them. Accept any negative feelings that your loved one wants to share without responding with similar emotions. Again, try to accept what they're feeling, what they're experiencing unconditionally, as best you can. These are all going to be difficult things for you to do, but again, trying to deal with the diagnosis one at a time, accepting the diagnosis, accepting their mental illness, being an invaluable emotional support, are all going to be ways that you're also going to be able to deal with what your loved one is going through. Be honest with your loved one. Again, if you're feeling angry, if you're feeling fearful, if you're feeling sad about what your loved one is going through, be honest with your emotions and being honest with your loved one. Focus on hope. There's a lot of research out, and there has been a lot of research over the last 10 years that people can recover from mental illness, and we need to focus on hope and recovery, and let your loved one know that. Give empathy and not pity. Also remember that illness affects the body, the mind, and the soul. Okay, it's not just one of those three. It's all three of those things: the mind, the body, and the soul. Again, sharing the diagnosis. Expect that everyone's going to react differently. Okay, so when your loved one receives a diagnosis, when your family receives the diagnosis of a mental illness, everybody's going to react to that differently. And again, what's important is however that reaction takes place, is honor those feelings. Also remember that people are only going to remember as much as they can handle at an emotional level. Okay, it's going to be a pretty heavy duty thing when somebody's diagnosed with a mental illness. Okay, so they may only hear bits and pieces of what their social worker, their doctor, their psychologist is giving to them. So again, you can be there as a pretty heavy, invaluable emotional support and hear some of the other pieces that they may not be hearing. You may also need to repeat some things for them that they're not hearing, some crucial bits and pieces of information, and that's okay. Try to be sensitive to your own needs as well as the needs of other family members and of the needs of your loved one. And also, your presence is going to show support. Just your physical presence is going to show your loved one support. Your ability to sit and listen and to be patient is going to be very important. Sometimes your loved one, that's all they're looking for, is someone just to sit and listen. They may not be looking for answers. They may not be looking for any type of certain reaction, just somebody to sit and listen to them. So that's kind of that first step. That's an overview of that initial diagnosis and some of the reactions that you may be going through and your loved one may be going through. But looking at some of the things that we just talked about, that I just talked about, can help you from an emotional state and a physical state kind of get through that first step. That's pretty difficult to handle at times. In terms of communication, working together. Families working together are obviously going to bring more strength to dealing with problems than its members or individuals ever could. Okay, so working as one person is never going to be as effective as working as a family together. Okay, so try to bring all family members together and working on problems as opposed to working separately. Again, get all family members involved in making decisions, making important decisions. The more perspectives, the more ideas that are shared, the better the decisions and the results are going to be. Just what are you saying? Try not to bury try not to bury your message in an avalanche of words. Okay. Speak briefly, speak directly, speak consistently to your loved one. Again, they may not hear everything that's going on. They may be pretty upset at that initial diagnosis, so you may have to give real brief pieces of information. You may have to be real direct with them and very consistent and have to say things over and over. I think it's real important to use I statements as often as possible. This will keep the listener real focused and also keep them very receptive. Try to pay attention to nonverbal communication. Okay, so if they're sitting there with their arms crossed or their legs crossed, that may mean that they're not listening, or that at that point in time they may not want to take your advice. So what they're saying, what they're not saying, may be more important than what they are saying. Their body language may be more important than what's coming out of their mouth. So we need to pay attention to nonverbal communication. And again, with the communication, the things we're talking about with communication, this is going to help you as a caregiver, decrease your feelings of stress and your feelings of anxiety and depression. Try to listen more with your ears. Hear with your ears, listen with your mind. Again, try to listen to what they're saying. Listen to that underlying message that your loved one is trying to get across. Listen for feelings as much as you can. Try to dig out underlying meanings. Go beyond the words if at all possible. Go beyond that surface level message that your loved one may be talking about. Try to create as much of a comfortable climate as possible. Let your loved one know that they're safe. Create this climate of create a climate that they're comfortable in, that they can express their thoughts, their feelings, that they know they're not going to get any kind of backlash from. That you're going to, again, honor their feelings, honor their thoughts. Speak freely. Let your loved one know that it's okay to speak freely. That they can speak what's on their mind. Try to seek a better understanding. Again, listening freely, going beyond the words. Always try and seek a better understanding to what your loved one's talking about. Talking with our bodies and listening with our minds. Again, touched on this a little bit before, reading body language. This is going to help understand how our loved one's feeling. Again, reading our body language, even more so than listening to the words coming out of their mouth. Messages of reassurance. Be sure to send out messages of reassurance. For example, sitting as opposed to standing. So a lot of the research has shown that When you're sitting, the person that's receiving that message is more comfortable in talking as opposed to standing. Open as opposed to closed body posture. Not sitting with your arms crossed or your legs crossed. Helps that person who wants to talk to you, who wants to speak, just feel a little bit more comfortable in doing that. Some special communication techniques. Again, following some of these communication techniques, some of these more specific communication techniques can help decrease your own anxiety and your own comfort level. Active listening. Mirror what your loved one's thoughts are. For example, your loved one may say something like, "Boy, am I mad." You know, your response may be, "So you're very angry." So you kind of just you're mirroring what they're saying. You're just kind of repeating back what they're feeling. Two-way communication. This is similar to kind of question and answer, and this is going to help reach the same understanding between two people. Just question and answer, constantly trying to understand where the other person's coming from. And it'll help you. It'll help the other person, your loved one, again, reassure them that you're really engaged in the conversation. You're really trying to understand what's going on with them. Some tips for being a good listener. Learning to communicate with a loved one is often simply a matter of just learning to be a good listener, learning to listen. You can do this by stopping yourself from talking, which is not always an easy thing to do. You know, just try to stop talking for 5 minutes and just listen to the other person talk about his or her feelings. Let your loved one talk for 5 or 10 minutes. It sounds simple, but it's a difficult thing to do, but it will make you a better listener. Try to imagine yourself in your loved one's own circumstances. Again, sometimes, you know, receiving that diagnosis of a mental illness can be very confusing and very upsetting. So try to put yourself in that person's position. Show you're paying attention by releasing physically, being irritable, and maintaining a good eye contact. Being irritable, that can be okay. Again, you're honoring your own feelings. You know, if you're angry, that's okay. You know, but that's also showing that you're being a good listener. Try to refrain from talking about yourself. Again, you know, the focus of the communication should be on your loved one at that point. As much as possible, ask open-ended questions. Try not to assume what your loved one is thinking or feeling. Some other tips for being a good listener. Try not to pass judgment onto the person. Again, you're just kind of you're just being there as a good listener. You're just being there for that person. You're kind of accepting them unconditionally. Reporting what your loved one says in your own words. So you're kind of mirroring what they're saying, but you might repeat what they're saying back in your own words to kind of help clarify the situation. So what you're doing with all these communication techniques, again, is you're not only helping your loved one in terms of their own communication and getting across what they're thinking and feeling, but at the same time, you're going to be decreasing some of your stress and some of your anxiety. And you're going to be helping the whole situation with the acceptance of your loved one's mental illness. Okay, helping your loved one. Maintaining a sense of dignity. Helping your loved one maintain a sense of dignity, I think, is extremely important. Obviously, when somebody is diagnosed with a mental illness, we're not taking away who this person is. They're still a human being, and we have to strongly encourage that they maintain their own sense of dignity. You know your loved one better than anyone. You know your family member or that person who is suffering from a mental illness better than any professional ever could. And that's important to know and to understand and to keep in mind. And you're going to be more help to your loved one than anybody else could. The one thing you want to try to do is try to stay away from that protective mode. Sometimes that can be more damaging than anything. You want to be encouraging, but you don't want to overprotect them. You want to help them make decisions, but you don't want to make decisions for them necessarily. Obviously, if it's a life or death situation, you may have to, but other decisions, you want to help them make their own decisions. Respect and dignity. Respect and dignity are every person's basic right, whether they're suffering from a mental illness or not. So again, respect privacy physically, emotionally. Things like knocking on the person's door before just barging in and opening that door. Not discussing confidential information with others without his or her permission. Those are two simple things in terms of respect and dignity. Respecting your loved one's right to make choices. We can do that by maintaining a sense of control over our own lives. If a choice seems silly or unimportant, try to see why it may be important to your loved one. What they may see as or what we may see as something that's silly or ridiculous, they may see as very, very important. So what we want to do is try to put ourselves in their shoes and see why it's so important to them. And again, once we try to do that, I think our stress and our level of anxiety and any other feelings of potential depression may decrease. If our loved one refuses important choices, for example, like medication to help them feel better, to make their life a little bit easier, we may try to negotiate possible solutions. A lot of individuals who do suffer from mental illnesses will refuse the medications. Again, that's an important choice that they have the right to do. One possible solution, though, may be that we negotiate other possible solutions to that. Again, treating them with respect and dignity is one of the most important things that we can do in terms of helping our loved one through a real difficult situation. Listening to concerns is real important. We want to ask for opinions. We want to let our loved one know that they're important to us. We want to involve their loved ones in our decisions, in their decisions. Listen to their opinions. Include them in our conversations. Again, don't eliminate them from important family matters, important family decisions. We also want to speak to our loved ones or those who are suffering from a mental illness as we want to speak to them as an adult. Don't talk down to them. Again, it goes back to respect and dignity. Coping with behavior. A sense of loss of control. A loved one who suffers from a mental illness may feel a sense of loss of control, or most likely will feel a sense of loss of control, typically over his or her life. And as a result, is potentially going to exhibit behaviors such as anxiousness. They may be very resistant, or they may be very demanding. And that's real difficult for a family member to cope with. So we have to try to understand, and we have to try to cope with that behavior. We have to try to understand, where and how our loved ones lost that sense of control. If we can recognize the reasons for the behaviors and learn the methods to cope, it's going to help us maintain a healthy relationship with our loved ones, and it's going to help us get through those real tough times. So again, try to recognize the reasons for their behaviors. Try to recognize, where they lost that sense of control. We're not always going to be able to recognize, or we're not always going to be able to control our loved one's behavior, but you can control your response to their behavior. Sometimes it'll be impossible to control their behavior, but we can control our own response to what their behavior is. We want to focus our response on the behavior, and we want to avoid blaming our loved one's personality or condemn his or her as a bad person. They may do things that we don't agree with, but that doesn't make them a bad person. So we want to focus our response on the behavior, not on the person. Try not to take the behavior personally. That's not always an easy thing to do. We don't want to downplay our behavior. We don't want to downplay our loved one's behavior's feelings. We don't want to blame ourselves. Let your loved one talk about their feelings, and don't downplay his or her feelings. We want to allow our loved ones to talk about his or her feelings. We want to try to find something to agree about. We want to give our loved ones chances to make decisions and be in control. Again, there are certain things that, if it's a life-death situation, obviously we might need to make more of an intervention than what would be typical. But try to take every opportunity to allow our loved one who's suffering from a mental illness to be in as much control as possible, and to make as many decisions as possible. Take a break, as a caregiver. Walk away from a difficult situation if you need to. Take a deep breath, count to 10, things like that. Those are really, really important to kind of gain perspective. It may sound very simple, but it's a very effective thing. Look for feelings behind the behaviors. Self-esteem. When our loved one's independence is lost because of a mental illness, self-esteem is going to suffer. There's been tons and tons of research that has shown a correlation between the loss of independence and low self-esteem, and the resulting low self-esteem. What we want to try to do is we want to try to encourage independence as much as possible on the part of our loved one. Give praise for effort and for things our loved one does for him or herself, even for little things that may seem very minor to us. Allow our loved ones to make, again, as many decisions as possible. We want to try to provide ways for our loved ones to feel needed. And we want to try to treat our loved ones with dignity and respect. Okay, the last part that I wanted to talk about tonight was taking care of yourself. Again, these first three parts, the initial diagnosis, the communication, and up to this last part, taking care of yourself, this all has to do with, again, with, dealing with what we can do to help ourselves as caregivers. Scheduling time for yourself. Whether you feel like you need the time or not, I think it's real important to schedule personal time. Organize some time and then stick to a schedule. If it's only an hour a day, a couple hours a week, schedule that time and stick to it. And make sure your loved one who is suffering from the mental illness knows that. That's okay. They're going to understand that. You need personal time. You also have to learn to say no. Especially to things that are unnecessary, unfulfilling activities. That's real important, learning to say no. You can't say yes to everything. You have to learn to share your feelings. Talking about your problems isn't complaining. Family members may assume that you're doing fine just because they simply don't know any better. If you don't talk about your problems, they may just assume you're doing okay because they don't know any better. They don't know about your problems. Family members are there for a reason. They're there to lean on, and that's okay. They would be the first ones to say, yeah, come and talk to me about your problems and lean on me. Support groups are available. There's tons and tons of support groups for those family members who have loved ones that are suffering from a mental illness, very specific to the diagnosis that your loved one's suffering from depression to anxiety to post-traumatic stress disorder, to various psychotic disorders to substance abuse. Journaling is often very helpful. Writing down exactly what you're feeling. Again, your feelings, are extremely important in all this. You're likely going to experience a range of feelings, again, from guilt to shame to fear to anger to frustration to sadness to disbelief through this whole process, from that initial diagnosis of your loved one with a mental illness to this whole process of treatment. All those feelings are going to be present, and that's okay. I think what's important is to know that those feelings are going to be there, that they're very normal, and that you honor those feelings. And they're going to change over time. Okay, one feeling is not going to be consistently there all the time, but they're going to change over time, and that's a completely normal thing. Use of community resources. Things like respite care, adult daycare exist for your benefit, for the benefit of caregivers. They're available for caregivers. That's what the community resources, that's what things like respite care and adult daycare are there for, to kind of give caregivers a break. Ask for help. There's no reason to isolate yourself when you don't have to. There's plenty of avenues out there that you can ask for help. And don't isolate yourself when you don't need to. Effective caregivers. The most effective caregivers can make reasonable, impartial judgments about both their loved one's situation and about their own abilities. If you know you're in over your head, be honest with yourself, and look elsewhere and ask for help. That's when you're going to be the most effective for yourself and for your loved one. And again, make honest assessments of the situation. Make honest assessments of your strengths, of your weaknesses. Be realistic in what you can and you can't do. Again, that's only going to help your situation. It's going to help decrease your own stress, your own anxiety. It's also going to help your loved one. Cut yourself some slack. Again, we can't be everything to everybody. It's impossible. And the last thing, which is, it sounds simple, but a lot of people just don't do it, and they may not see the results right away. But eat smart and exercise. The rewards will far outweigh the effort. A little bit of exercise every day, a little bit of exercise every week, and eating smart can do wonders for you. That brings us to the end of the webinar. Again, my name was Dr. Mike Lau, and this is brought to you by Health Directions. You can learn more information about Health Directions, and you can schedule an appointment through our phone number. You see 1-800-288-5912, or you can email healthdirections@ncbhs.org. Again, you can type in any questions that you have. If I'm not able to answer these questions, I will answer them, get back to you within 24 hours. We do have a number of webinars that are coming up in the future weeks, and we do have webinars available that we've already completed. And this one that I just completed tonight will be available within 48 hours on our website, which is at www.healthdirectionsonline.org. Let's see. Hang on just one second. Okay, if there are no questions, again, thank you for joining me tonight. If you do think of some questions, feel free to type those in and I will get back to you within 24 hours. So